Hello everyone. Hello everyone. Our today's topic. The topic is lecture on anti-anginal drugs. So first of all, you should know what are anti-anginal drugs. So anti-anginal drugs are the drugs that helps to prevent terminal attack of angina pectoris. So angina pectoris, it is a condition that is characterized by chest pain that occur due to the reduced supply of the oxygen to the heart muscles. So there are two principal forms of angina pectoris. One is the classical form, that is stable angina, and other is the variant form, that is known as metal angina. Fringe metal angina. Additionally, there is third is the unstable angina. Now the classical angina, that is the stable angina. The stable angina, it is most common. So which form is the most common? It's the stable or classical form. And it is exerted by physical exertion, stress, eating, or sexual activity. So the pain subsides, the pain subsides when the activity stops or when myocardial oxygen demand decreases. So underlying cause is usually the what is the cause of the stable angina? The cause is arteriosclerosis in larger coronary arteries. So these arteries fail to dilate adequately in response to increased myocardial demand that due to the fixed obstruction. So blood flow does not increases as needed, leading to ischemic pain. So what is the management? The primary goal of drugs in stable angina is to reduce the workload of heart and improve the oxygen demand to the ischemic heart. Examples are the nitrates. So the nitrates, what they do is they dilate the veins more than that of arteries. That reduces preload. Now preload is the volume of blood that is returning to the heart, and that is why subsequently the myocardial oxygen demand. Apart from that, we can use beta blockers. Example are the atenolol, metoprolol. They reduces the heart rate and contractility and therefore lowering the oxygen demand. Apart from that, we can use calcium channel blockers. like amlodipine, verapamil. They reduces the afterload by dilating the arteries and decreases the heart rate and contractibility. The second form of the second form is variant or Prince metal angina. So this form of angina is, remember, it is less common and it occur at rest or even during sleep. The attacks are unpredictable and they are caused by transient coronary vasospasm, which are sometimes superimposed on atherosclerotic coronary artery disease. So this type of angina is caused by abnormal reactivity of the coronary arteries that lead to temporary spasm and there is reduced blood flow. These spasms can occur in both the healthy and diseased arteries. So the drug here we can use is calcium channel blockers. So what are these? Are the first line treatment drugs because they relaxes the smooth muscle of the coronary artery and hence they prevent the spasm. Nitrate can also be used. So these can be used to relieve acute spasm by dilating the coronary arteries. The third form is the unstable angina. In unstable angina, there is increase in the frequency, duration, and severity of the angina attack. It occurs due to the rupture of the thermometer's plaque leading to platelet aggregation, and there is coronary artery occlusion. So, due to the complete coronary artery occlusion, that can lead to myocardial infarction, that is the heart attack. Now, let us classify the drugs. The drugs we can classify. Now, the classification. The first is the short acting. The example is glyceryl trinitrate or nitroglycerin. The long acting example is isosorbide dinitrate. So remember that it is given by sublingual route. Dinitrate, mononitrate, the second are the beta blockers. The example are the propanol, metoprolol, atenolol, etc. The third are the calcium channel blockers. Example are the verapamil, diltiazem, nifedipine, etc. The fourth are the potassium channel openers. Example are the nicorandil. Other we can use is dipyramidol, etc. Now let us discuss the first we are going to discuss is the nitrates. So what is the mechanism of nitrates? In order to understand how nitrates work in managing angina, we need to grasp two important concepts related to heart function. One is preload and other is afterload. The preload, it refers to amount of the blood that is returning to heart and filling the ventricles. Before the heart contracts. Think of it as a stretch of the heart muscle when it is filled with blood. So it is the volume of blood in the ventricles at the end of diastole, just before it pumps out blood. Now, how nitrates affect preload? The nitrates, remember, it works by dilating the veins. Nitrate dilates the veins, which are the blood vessels that carry blood back to the heart. So when the veins they are dilated, more pool of blood enter into the veins and less blood returns to the heart. So this reduces the volume of blood, that is, it reduces the preload, and that leads to less stretching of the heart muscle. So reduces preload means that heart does not have to work as hard, and therefore the oxygen demand of the heart muscle decreases. That is beneficial in the angina. Second is afterload. Afterload is the resistance that heart has to overcome to pump blood out of ventricles and into the arteries. Now you can think of it as a pressure in the heart must work against to eject the blood. So it is influenced by the total peripheral resistance and arteries, diameter of arteries and arterioles. Now how nitrates they affect afterload? Nitrates causes some dilation of arteries, that reduces, it causes dilation of arteries, although not as much as veins, that reduces the resistance to blood vessels. So when the arteries they are dilated, the resistance against which the heart pump blood is reduced. So this lowers the blood pressure and make heart to eject blood and thereby reducing the cardiac workload. Now let us discuss the mechanism of action of nitrates. Nitrates are rapidly converted to body to nitric oxide. That is a molecule that has a powerful relaxing action on the, it has a relaxing smooth muscle in a blood vessel. When nitric oxide is relieved, it activates enzyme that is known as guanyl cyclase inside the smooth muscle cells. So this enzyme then increase the level of CGMP. So the increased CGMP level leads to series of biochemical changes that causes relaxation of the smooth muscles, especially in the bloodstream. So the relaxation of veins reduces the preload by allowing more blood to pool into the veins, decreasing the amount of blood returning to the heart. And in the arteries, the relaxation of arteries reduces the afterload by decreasing resistance, making it easier for heart to pump blood out. So nitrates also help to relax the coronary arteries which supply blood to the heart muscle. So that can be especially helpful in variant angina that is caused by coronary artery spasm. So why do these action helps in angina? By reducing both preload and afterload, nitrate decreases the oxygen demand of heart. At same time they helps to improve the blood flow to the ischemic oxygen areas of heart muscles. So together these effects relieve the chest pain and improve exercise tolerance in the patient.
Organic nitrates like crystalline trinitrate, they are lipid soluble. So this character allow them to be well absorbed through different routes. Absorption from mouth lining, absorbed when taken orally, or through skin, absorbed through the transdermal patch. So when the nitrates are taken orally, first pass metabolism in the liver affect their bioavailability. Except for isosorbide mononitrate, most nitrate undergo extensive metabolism in liver when taken orally. Metabolism and duration of action. Nitrates, they are broken down by enzyme that is glutathione reductase. So the duration of the action, the rate of absorption depends upon how quicker the drug is absorbed from the site of administration. Glyceride nitrate and isosorbide dinitrate, they have a short duration of action when they are taken sublingually under the tongue due to rapid absorption, but they are longer acting when they are taken orally because of their slower absorption. The side effect of glyceryl nitrates are mostly due to vasodilation. There is a throbbing headache commonly due to the dilation of the meningeal blood vessels, flushing, weakness, palpitation, dizziness. So these are all caused due to the vasodilation. Methemoglobinemia is a condition where the hemoglobin it is converted into methemoglobin, so reducing the oxygen carrying capacity of the blood, and it can be concern in patient with severe anemia. Tolerance can develop quickly but also wear off within hours when the drug is discontinued. After prolonged use, sudden withdrawal of nitrate it can cause spasm of the coronary and peripheral blood vessel that may lead to myocardial infarction and sudden death. Some patients experience a lower angina threshold during nitrate-free intervals, leading to episode leading to increased episode of nitrates. To avoid these issues, the withdrawal of nitrate should be done gradually For patient with increased angina during nitrate-free intervals and antianginal drugs of other class should be added. Now the interaction of nitrates, combining nitrates with sildenafil used for erectile dysfunction can cause severe hypotension. Additive hypotensive effect may occur if the nitrates they are given in combination with the other vasodilator. So that would lead to increase drop in the blood pressure. Now, what is the physical property of glycerol nitrate? It is a volatile liquid. The glycerol nitrate tablets must be stored in a tightly closed glass container and not in plastic containers. That would, in plastic containers, evaporation would occur. So route of administration, it can be given by sublingual route used for terminating an acute attack of angina. The tablet is placed under the tongue or can be crushed under the teeth and spread over the buccal mucosa, and it acts within 1 to 2 minutes, and it reaches the peak blood level in 3 to 6 minutes due to direct absorption into the systemic circulation. The plasma half-life is approximately 2 minutes. Once the angina pain is relieved, the remaining part of tablet may be spit out or swallowed. A sublingual spray formulation has been developed that acts more rapidly than the tablet for immediate relief of angina. It can be given by either by orally route also. Glycerol, it can be given as transdermal route. Glycerol trinitrate, it is readily absorbed from the skin. Transdermal patches developed to provide steady drug delivery for 24 hours. Onset of action is it start working within 60 minutes. It can be also given in a transmucosal dosage form, a form that is stuck to gums under the lips, and it acts in 5 minutes and release the drug for 4 to 6 hours. Several nitrate derivatives they are used for treatment of angina having unique pharmacokinetic properties and specific clinical action. The other is isosorbide dinitrate. It is a solid component similar to glycerol trinitrate, and it has a vasodilatory effect. It can be given by sublingual route, and it has an onset of action slower than that of glycerol trinitrate, and it peaks in 5 to 8 minutes. The half-life is 40 minutes, and the sustained release can provide protection for 6 to 10 hours. The last dose should be taken no later than 6 p.m. to allow nitrate to decrease to allow the nitrate level to decrease during sleep at night, and thereby preventing the tolerance. Other is isosorbide mononitrate. It has half-life of 4 to 6 hours, making it a longer acting nitrate compared to isosorbide dinitrate. The last dose should be taken in afternoon to avoid overnight tolerance. So let us discuss the use of nitrates. The first is they are used in angina pectoris. It is effective in both the classical and variant angina. It provides relief within 3 minutes, and some require a second dose or take up to 9 minutes for full relief. Second, it is used in acute coronary syndrome. Third, it is used in myocardial infarction. Fourth, it is used in congestive heart failure and acute left ventricular failure. Fifth, it is used in biliary colic. And sixth, it is used in esophageal spasm. And last, it is used in cyanide poisoning. So nitrate generate methemoglobin which binds to cyanide to form cyanomethemoglobin. Now the beta blockers, they work by blocking the beta adrenergic receptors. So normally adrenaline it binds to these receptors and causes heart to beat faster and more forcefully. By blocking these receptors, there is so these beta blockers they reduce heart rate and contractility. So these that means that the heart does not have to work as hard. Imagine a car engine. If you keep reviewing the engine, it consumes more fuel and heat. Similarly, if the heart beat faster and harder, it consumes more oxygen. So beta blocker helps by keeping the engine of the heart running at more steady and efficient pace. Beta blockers also helps to lower the blood pressure by reducing the force with which heart pumps the blood. Lower blood pressure means less strain on heart and blood vessels. So over time this helps in preventing damage to the heart vessel. Since the heart is beating more slowly and with less force, it requires less oxygen to function. So it decreases the oxygen demand. So that is important in angina where there is already reduced oxygen supply due to narrowed coronary artery. By lowering the oxygen demand, beta blocker helps to balance the supply of demand of oxygen to the heart muscles. Beta blockers also causes a redistribution of blood flow within the heart while they reduce total blood flow by blocking the beta 2 receptors that causes widening of blood vessels. So they improve blood flow to the inner wall of the heart muscles which are more at risk during an angina attack. So beta blockers helps to prevent sudden increase in heart rate that occur during exercise, stress or anxiety. So in situation where adrenaline level rises, beta blockers stop the heart from responding too strongly and preventing an angina attack. So beta blockers they are very effective in managing stable angina by reducing the frequency and severity of the chest pain episode. However, they are not effective in variant angina where coronary artery spasm.
So think of it as having two brakes in car. If one brake type beta blockers is applied without managing the other, that is alpha receptor, it might lead to skidding, increase spasm. Now example is verapamil. It is a calcium channel blocker. So verapamil, remember, it inhibit the influx of calcium through L-type channels in smooth muscle cells of arterioles. It inhibits the influx of calcium that leads to relaxation of the smooth muscle, causing vasodilation and reduced total peripheral resistance. Verapamil has some alpha adrenergic blocking effect. It contributes to vasodilatory action. So this alpha blockage would help in further reducing the vascular resistance, but it does not significantly lower the blood pressure due to the compensatory mechanism in the body. So apart from that, verapamil has negative inotropic effect. So it reduces the force of contraction of the heart muscle by decreasing intracellular calcium available for contraction. It has negative chronotropic effect. It decreases the heart rate by slowing down the firing rate of SA node. Apart from that, it has negative dromotropic effect. It slows down the conduction through AV node, which can be used in controlling rapid heart rate. So by dilating the coronary arteries, verapamil increase the coronary blood flow that can improve the oxygen delivery to the heart muscles. So verapamil can worsen pre-existing conducting defect and should be avoided in patient with second or third degree AV block. Other is diltiazem. It is a calcium channel blocker. It causes vasodilation primarily of the arterioles, though it is less potent in regard compared to nifedipine. It increases the coronary blood flow by dilating the coronary arteries. Again, it has negative inotropic, negative chronotropic and dromotropic effect. What are the uses of calcium channel blockers? First of all, they are used in angina pectoris. All calcium channel blockers helps to reduce the frequency and severity of both the classical and variant angina. So they are used in unstable angina. They are not the primary treatment but can be used as adjuvant therapy to nitrates if coronary vasospasm is significant and is not controlled by nitrate alone. They are used in hypertension. All these calcium channel blockers, they are effective in managing hypertension and are used in first line treatment. Third, they are used in cardiac arrhythmias, highly effective in treating paroxysmal supraventricular tachycardia, and they are used in hypertrophic cardiomyopathy. Apart from that, nifedipine can be used as alternative treatment to manage the premature labor. Verapamil has been used to alleviate the nocturnal leg cramps. They are also used as a, uh, in Raynaud disease, etc. Other is the potassium channel blockers. The example of potassium channel blocker is, remember, Nicorandil. It works by activating the ATP sensitive potassium channels in vascular smooth muscle cells. So this activation causes a hyperpolarization of the smooth muscle leading to relaxation and vasodilation of blood vessels. Nicorandil also acts as a nitric oxide donor. It increases the cGMP level in smooth muscle that lead to further relaxation of the blood vessel. So it causes arterial and venous dilution. It increases the coronary blood flow by dilating both the vessels and deeper resistance vessels. It improves angina in both stable and vasospasmatic angina. Common side effects are flushing, palpitation, weakness, headache, dizziness, nausea. So these are the Now let us discuss the management of myocardial infarction. Remember, myocardial infarction is defined as ischemic necrosis of the portion of myocardium due to sudden occlusion of the coronary artery. So it is caused by an acute thrombus at site of the atherosclerotic obstruction. So first of all, if chest pain is not relieved by 3 doses of glyceryl trinitrate given 5 minutes apart, and opioid analgesic can be given. That include morphine or pethidine. Or sedative can be given like diazepam to alleviate pain and anxiety. Oxygen can be given proper by inhalation route to provide assisted respiration if necessary to maintain adequate oxygenation. Slow IV infusion of saline or low molecular weight dextran that can be given to maintain the blood volume without causing volume overload. Acidosis which occur due to the lactic acid production can be corrected by intravenous infusion of sodium bicarbonate. Prophylactic intravenous infusion of the beta blockers can be given like metoprolol. Aman cut de da. Should be initiated as soon as possible. Beta blocker reduces the incidence of arrhythmia, decrease myocardial oxygen demand and limit infarct size. Management of pump failure. The goal is to increase the cardiac output or decrease filling pressure without increasing cardiac work or lowering blood pressure. So furosemide
It can be given if pulmonary wedge pressure it is greater than 20 millimeter of mercury to decrease the cardiac PLO. Vasodilators, nitroprusside may be used or combined dilators based on the hemodynamic parameters. Inotropic agents like dopamine or dobutamine can be used. Aspirin should be chewed, swallowed as soon as MI is expected. Anticoagulants are primarily used to prevent the deep vein thrombosis and pulmonary systemic systemic arterial embolism. Long-term use of fibrinolytic agents like streptokinase, urokinase may be used to achieve reperfusion of the infected area within 1 to 2 minutes of the symptoms. So these are the control of hyperlipidemia, dietary substitution with unsaturated fats and use of hypolipidemic drug, especially statins are important for managing the dyslipidemia. ACE inhibitors, congestive heart failure like imapril, lisinopril, they can be used for long-term survival benefit by preventing subsequent cardiac heart failure.